Hello there, hi.
How are you?
Shem. Hello there,
Nice
you're
to
Sean.
meet you.
Hello there, hi, I'm Dr. Hargroves. What we're going to do is we're just going to bring you around here. I'm going to quickly examine you, and then actually we're going to take you straight round to the imaging department and do that scan. So just come through this way. Hey, look at me. Put your hands up for me. Fingers wide apart. Good. Turn your hands around to face the ceiling like that. Good. What we're going to do is put a needle into one of your arms here, take a little bit of blood, and then we're going to put you on flat on that CT table and take some pictures of your brain. Volume. Flow. Here's a clear abnormality. Okay, so Martin. Okay, so if we thrombolise him.
Thrombolise him?
Yep, straight away, straight away.
Because we're giving you this medication, nothing like that, okay? Any history of any trauma? Do you have any sort of fall or accident, anything along the
Jay, tell me about Mr. Wild.
10 o'clock this morning, Mr. Wild went to the bathroom and collapsed, and is now unable to talk. He's just become unable to walk. His legs stopped working.
So, Jay, if you could turn the camera around so I can have a quick look at Mr. Wild, please. Hello there, Mr. Wild. Hello, I'm Dr. Hargroves. I'm one of the consultants. How are you? Okay. And what is it that's not working?
My left will rise up and not very far. It feels like I've got big toes.
Yeah, I'm with you. Jay, that's it. Bring the camera back a bit, Jay, for me so I have a good look at him. Wonderful. So, Mr. Wild, can you lift up both hands for me, please, so they're facing the ceiling? Okay, and how about that left leg? Can you lift up that left leg? Okay, so that's a little bit weak as well. Okay, Jay, where are you at the moment?
Ashford,
You're at Ashford, okay. And how long do you think it'll take for you to get here?
25 minutes.
Okay, Jay, I'll see you here in 25 minutes. He has clearly got a sudden onset of weakness in his left arm and his left leg. He's having difficulty speaking. He's got facial asymmetry as well. And there are two types of stroke. One was where a vessel bursts, another when a vessel clots. The latter is the most common, an ischemic stroke. And I think for this next gentleman's case, that's unfortunately likely to be the case. So what will be absolute imperative is that we're able to get him straight from the ambulance into imaging. Hi, is this David Wild? Hello there, hi. David, I spoke to you on the phone. Yeah. Put your hands up for me. That looks better than it was earlier. We'll go straight round to CT. Yep, straight round to CT. David was completely well previously and then developed sudden onset of his symptoms. So we've got a known time of onset. And we know that every minute matters. So our colleagues in the imaging department are waiting for David.
Thanks, John. Steady.
The AI takes the pictures from the scanner and interprets it straight away and then puts it on a different platform for us to view.
That injection's going to start now. Keep your head very still.
So the AI has, that came through probably 5 minutes earlier, has suggested that there is a reduction in flow within the right middle cerebral artery. Wonderful. It has allowed us to operate in those three factors of speeding up the image acquisition and interpretation, allowing the transfer and communication with colleagues at other hospitals, and 3, as a decision support to me and other clinicians. Put your hands up, fingers wide apart. Turn them round so they're facing the ceiling. Keep them like that, keep them up like that. Now close your eyes. So Minna, there's still a drift in his left upper limb. That finger there on your nose. Good, okay, let's have a look at your legs. I think that your speech is going to get better, whatever we do.
Very good.
Okay, so let me have a quick look at those scans and we'll let you know. Let's have a quick look at this perfusion scan. Nothing immediately jumps out. Let me know if you see something for me. And this is the AI overlap, you know, and it's highlighted a slight cortical area, but nothing significant. So you've got a very nice looking brain scan. Okay, you've got lots of healthy brain. I think there probably has been a tiny little stroke, but given that your symptoms are rapidly improving and that you've already got the blood thinning on, I don't think giving you any clot busting medicine is going to help. Right. There's certainly no large artery that we need to put any wires in. Right. Today's Monday the 19th. I think that your speech is going to be a lot better by tomorrow. I think it's best you staying overnight. Let's see how you get on, but all being well, home tomorrow. Look at this! Aren't you doing well?
Yeah, I feel fine, yeah. I feel so much better, you know.
Have you done well?
Yeah, I think so.
You're presumably happy with him?
Oh, very much, yeah. We're going to discharge today.
Yeah, great.
So,
Home today. Pop your hands up for me. Fingers wide apart. Turn around to face ceiling, like that. Now close your eyes. Keep your eyes nice and closed. And don't let me push down. Keep your hands up. Keep them up.
Oh, right.
You keep them up. Don't let me push them down. Don't let me
Oh, right. That's good. Go,
Good. That's fantastic. Just relax for me. Just relax.
Right.
So you couldn't really move this properly
No,
yesterday.
couldn't, no.
And it's pretty much back to normal.
Yeah, I feel 100% better. You know, compared with yesterday, I couldn't thank you lot enough, to be honest, for what you've done. Thanks for everything, anyway.
You're welcome.
Thanks a lot.
So the use of artificial intelligence as a decision support software for stroke has allowed us to treat people like Sean quicker, and we know that every minute you lose 2 million brain cells. So there's no doubt he is better than he would have been without artificial intelligence.